So, hopefully this will be okay. Myself and Claire are coming down just to do this. We talked to you. Our Dr. Ian McLeod is not here because he's sick. So we'll pretend to be Dr. McLeod. And this is a presentation that he used up in the Sawley Centre at Carthage. And it's maybe just a wee bit too many figures and all the rest of it as well. But we are happy to answer any questions and talk about absolutely anything really around about donation. So I think the talk was really why is organ donation needed, and I think the next few slides is just really looking at the figures as to why we need more people to think about organ donation as well. So this is looking back over the years back to 2006, and you can see from that the number of patients on the transplant waiting list were consistently going up. But the number of people that were actually donating or in a position to be able to donate is kind of staying static. And this number here continued to increase year on year. And the organisation that deals with transplantation and organ donation were looking at it and thinking, how can we improve the numbers and sort of try and get more people to donate? So they set up a task force review back probably in 2006, and they looked at everything that they thought could actually impact and then change the number of patients or people that did go forward and actually donate. So the task force review reported back in 2008, and all the devolved health authorities took on board every single one of the recommendations that were made at that time. And there was 14 different recommendations, but we'll not go through them all here. Like, this is just another slide. Now, this in the original had the different countries, but they've got lost somewhere in the slide set. So this was the number of donors per million population within the UK. And I think it's probably sitting at about 12 donors per million population. Whereas when you go to European countries like Spain, which is the gold standard for organ donation, their number of donors to go forward for organ donation per million population was 35. So it was a huge difference. So they were as a country and as an organisation, they did look to see what Spain were doing differently, and all of these other countries here. Because some of these were like the Central European countries, like Croatia and Poland and Latvia are in there as well, and better at organ donation than we are in the UK.
Different countries, different kind of things drive different countries, and they have different kind of ethical frameworks surrounding organ donation. So that's one of the reasons why there is a difference, but not to create that much of a stark difference. But certainly there are things that would be accepted in perhaps Spain that we in this country at the moment wouldn't find acceptable kind of ethically. So that's one of the challenges, is that how people donate in different countries is quite different to how they donate here.
Like, we've got different infrastructures to be able to do different types of donation in Spain at the moment that we just don't have in the UK, and that we'll never have, I don't think, ever in the UK. So this is the UK model, and this is what came out of the 2008 task force recommendations. So each different part had different work that they had to do. The bigger, wider National Health NHS Blood and Transplant had to develop a national organ donation organisation. So we were all employed by different health boards and different trusts in our role as specialist nurses for organ donation, but they took us all under the umbrella of NHS Blood and Transplant, so that we were all doing the same thing and using the same paperwork. They wanted effective coordination and retrieval of the service as well. We used to call on Edinburgh to come up and do our retrievals, but now what they've done is they've commissioned all the transplant units to provide a retrieval service. So if Edinburgh weren't available to come to Aberdeen to do a retrieval, then we can go to the next nearest centre and ask them to come up to Aberdeen and do the retrieval. In the past, if there were subsequent donations, then we had to wait on one donation process finishing and then getting the team to come once they were finished and had a rest, really. So, and we can go down the country, because at the moment I think there are 8 retrieval teams in the whole of the UK that can come and do retrieval of abdominal organs. And there's 6 retrieval teams that can come and do retrieval of cardiac organs. And there's 2 centres that can do paediatric transplant and donation as well. So, the Department of Health had to put funding in it, they had to look at the different ethical and legal issues, they had to do performance management of everyone as well, and they decided that what we would do, how we would work, and even the surgeons and surgical teams as well. And the public recognition part of it is now the Order of St John's. Have you heard of that as an organisation? They now, throughout the whole of the UK, have a ceremony every year to honour donors, and so their families are all invited from, well, within Scotland we have a ceremony down in the Royal Botanic Gardens in Edinburgh. So all the patients' families that have donated in the preceding year are invited to that ceremony and given an award in thanks of their relatives' donation. And then we take them out then afterwards. There's a national memorial within the Botanics Garden as well that was commissioned and set up. So, but then coming on to the acute hospitals, every intensive care unit to try and support and promote organ donation had to have a clinical lead, and that is usually one of the intensive care consultants, because predominantly if someone is going to be able to donate their organs, that patient is going to be someone in the intensive care unit who either meets brainstem death criteria or is going to have active treatment withdrawn. So that's where the patients come from. So the clinical leads are there to support organ donation and to provide education and support to their intensive care colleagues as well, so that every patient, that organ donation becomes a usual event and it's seen as normal practice within the intensive care units. The coordinators as well, historically used to be part of transplant units and transplant centres, but it made more sense for them to be in the intensive care units where the patients were who could go forward for organ donation. And every hospital or every board or trust in England has to have a donation committee, so that they can oversee donation in each of the hospitals where donation is a possibility as well. And then part of that is about doing public engagement, which we're kind of coming out and doing here now with you guys as well, just giving you more information about donation as well. And there's some documents that have got parts about organ donation having to be considered as well. This is a Living and Dying Well document that was produced as well, saying that all parts of the NHS need to embrace organ donation as a usual and not an unusual event. So, and to design local policies and procedures around about organ donation so that it becomes part of every discussion around about end-of-life care where it is deemed to be appropriate as well. And then, so the task force recommendations were started from about 2008-9 onwards, and that is how many organ donation, the increase in organ donation since all the recommendations were put in place. So a 63% increase over the time frame, and I think that was for the whole of the UK, incorporating 13-14. I don't know if we've got it on the next slide. Yeah. No. So from the changes taking place as well, the number of patients on the organ donor, the waiting list started to go down as well because more patients were being transplanted because the donor numbers increased as well over that time. And they're actually seeing that within renal transplant units they're managing to close renal bed for dialysis because there are less patients waiting for a transplant as well.
Notice those aren't big figures.
No,
even at this one here, just 1,320 people a year become organ donors, and that's because you have to die in very unique circumstances. You can't just die anywhere in a hospital or anywhere in the community. You have to be, and at this point in time, certainly in Scotland, you have to be in an intensive care unit with a breathing tube down your throat or in your tracheostomy, and you have to meet certain criteria. You have to not have had, a cancer. You have to have not have had kind of any kind of problems with your brain. You know, there's so many criteria. So actually, when you take the amount of organ donors who are on the register, and then you take the amount that actually die in ITU, then you take the amount that don't have any contraindications to organ donation, you're left with a very, very small figure. So across the whole of the UK, I always think that that's an extremely small figure, 1,320, considering that we've got thousands and thousands and thousands of people on the register. I don't think people quite realise that not everybody can be a donor. You have to kind of die in the most kind of traumatic of circumstances almost, in the ICU. And either be brainstem dead, or be your care has become futile because you're not making any progress, so we withdraw care. So that's why that number is so small compared to the amount of people who are on the register.
So if someone dies in a car accident, are they still considered for?
If they came into hospital and they didn't die in the emergency department, i.e. they weren't actively dying, if they could stabilise them and then bring them into the ITU stable, so that, because our organ donation process takes 24 hours from start to finish. So if you think that that person has to come in and has to remain stable for those 24 hours, if you think we're trying to support their organs, make sure they're well perfused, good oxygen supply, so we need to keep them stable. So if they've got their blood pressures in their boots, we can't consider them. If they're not managing to oxygenate their blood, we can't consider them. So there's lots and lots of things that, lots of factors that come into it. But yeah, somebody was in a car crash, they came into the emergency department, we were able to stabilise them, or they went for CT scan, and the CT scan showed that they had an unsurvivable brain injury. A decision would be made at that point by the consultants in ITU whether they would admit them into our unit for the purposes of organ donation, to support them to organ donation, which would take about 24 hours after we'd spoken to the family and got a yes from the family. Alternatively, you could be in intensive care, having had a car accident, maybe not having an unsurvivable injury, not being brain dead, but you may just not be making any progress, and the only thing that's really keeping you going is the artificial ventilation that we're delivering, and that can't go on forever. So a decision is made by the medical staff and the family combined that the fairest thing to do at that point is to withdraw treatment, because there's never going to be any improvement, so you could donate in that way. But it's, if you look at people having car accidents and what have you, the vast majority don't come to ITU for an organ donation. We get a very, very small percentage of these patients come to us. A lot of them, if they die, a lot of them die either at the accident or in the emergency department, because they're literally kind of trying to fight to keep them alive. And we can't take patients like that, unfortunately. We have to have them stable so we can support them for the 24 hours that it takes to facilitate the process.
Why is that a 24-hour stable?
So we have to do lots of kind of tests on the people who come in. So we run off blood tests which have to be sent down to Edinburgh, so for tissue typing and virology. So even though we have to get the family in to be able to take a social history, a travel history, sexual history from family members, because obviously this person can't speak for themselves at this point. But we can only glean so much information from them. But say, for instance, somebody had HIV infection. It doesn't mean they can't be a donor, but we need to know about it, so that then if that organ is explanted and transplanted to somebody else, that we are transplanting it to somebody who also has an HIV infection, so it's not going to affect them. Or if they have something like toxoplasmosis, which is like you get from cats, whatever, this can really affect people. However, if they're given a drug, and these people who are getting the transplants are vulnerable, they're immunely suppressed, they're very, very sick, so we can't be transplanting things that we don't know. We can't not know if we're transplanting an infection, a virus, what have you. In addition to that, we have to do an offering process. So this is what happens after we've accepted the person, the family have given their say, so we've signed all the documents, we've sent off the blood tests, we go and visualise the patient and do what we call body mapping to make sure there's nothing unusual that shouldn't be there, lumps, bumps, what have you, even things like recent tattoos that maybe haven't been done in this country. All these things can make a huge difference. And then what then happens is, once we've got all that information, we load it onto a computer and we start an offering process. And that's basically, if it was a full organ donation, so somebody who was brainstem dead, we would offer out, assuming that all their organs were ready, we'd offer out all the organs that we can. So it would be heart, lungs, liver, kidneys, pancreas, could be small bowel as well, abdominal wall. So all these things could be included. And then we have to offer to all the centres. And we get a list basically. So we go for super urgent hearts first, all the people who would potentially die within 72 hours without a transplant. If this donor doesn't match their tissue type or their size or what have you, we offer to Great Ormond Street, for instance. So sometimes we might get a big person in, but obviously Great Ormond Street can't accept anybody big because all their patients are little, but you might get a small adult in for whom Great Ormond Street would be happy to accept a heart or a pair of lungs or what have you. So there's lots of matching that then needs to take place. And when we make an offer to a centre, they've got an hour to get back to us. Now, for us that's really frustrating because it's an hour of twiddling our thumbs thinking, are they going to take it, they're not going to take it. But in that hour, they are calling their recipient, calling the person who's waiting on the transplant, getting them in, seeing if they're well enough, doing blood tests, what have you, getting people into the hospital. Sometimes if you think that to get a lung transplant in Scotland, you actually have to go to Newcastle to get a lung transplant. So potentially you could be up in Aberdeen having to travel quickly down to Newcastle to receive your transplant. Obviously things take time. So everything adds time to the process. If the patient becomes unstable, we need to take time to stabilise them and try and optimise them as well. We've got an optimisation kind of plan that we give to our nurses, and it helps kind of keep the organs as good as they possibly can. But it takes time to do sometimes, especially if people have got kind of ventilating problems. A lot of people have got like an aspiration pneumonia from having a tube down their throat and things like that. So there's lots and lots of things that happen. Then once somebody accepts an organ, we then have to get a specialist team to our hospital, which can take 2 or 3 hours for them to come. If it's our Scottish organ retrieval team, they're coming from Edinburgh. But if they're already out at a donor, we can be going as far down Leeds, kind of even as far down as London to get a team to come to us, because it's not surgeons within our hospital that do the operations, it's specialist team, retrieval teams that come. So all this takes time. We cover Raigmore and Inverness as well, so in the middle of the night it includes trying to get the airport reopened for the teams to fly in. You know, there's lots and lots of things, so logistically it's a nightmare. So that's why it takes, we always say at least kind of 24 hours, because generally speaking it does take 24 hours, doesn't it?
Yeah, it does. It's just putting all the safety barriers in there as well to make sure that the organs are healthy and go to the best recipient, and that they're going to do well when they go to the recipients too, but it is.
And often, you know, we'll have surgeons on the end of the phone who will be kind of waiting for the surgeon within our hospital to visualise, say, the liver, to be able to say, yeah, it's good, and they're literally then going knife to skin in their hospital to start taking out the liver of the patient that's going to be receiving it, while we're trying to pack it up and put it in and get it onto a plane to fly it to where it's going. You know, these things, so there's a lot of organisation that needs to take place. Everybody needs to be ready. And if somebody's not ready, we can't start, basically. So particularly for cardiothoracics, for heart transplants, we often have to hold up the process because we need to, these are the ones that tend to need a bit more time to get their patients ready, get them into theatre and get the kind of preparatory work done and so on. So it's quite a lengthy process. It can go on even longer than that, unfortunately, but we do try and keep it as short as we can. Hi.
And how long could organs last from when they're taken out?
Well, from the point that each organ has a different kind of shelf life, if you like. So kidneys last the longest. They can be transplanted up to 24 hours kind of after they've been taken out of the body. However, other things need to go quickly. Livers need to go quite quickly. Lungs need to go very quickly. So how long have we got?
Hearts are the shortest time frame, so they're 4 hours from being explanted to being plumbed into the patient who's going to be the recipient, and then you've got the travel time in that as well. Lungs are about 12 hours, and I think livers are 12 hours as well. But they're designing all this sort of equipment now to perfuse organs on at the point of retrieval. So now if we have Edinburgh coming up and they know that the kidneys are going back to Edinburgh and Glasgow, they bring this equipment, we call it the LifePort. Google it, and it's just like a wee incubator box type thing, and they can pop the kidneys onto this perfuser, and it will perfuse the kidneys with fluid, and the transport time down to the centres where they're going to be transplanted. And they do say that these kidneys that are being perfused like that do well and work sooner than if they were, because historically they're packed in ice basically, fluid and ice to keep them cool. Livers don't have a machine at the moment to put them onto, but they are looking at that all the time as well.
They do in England.
Oh, for the livers?
Yeah, they've got the Organox machine in England,
Okay.
but it hasn't come to Scotland
I
yet.
think they've got one, but then they're not using it yet.
There's the Transmedics machine. You've
Oh,
got that on
I've
your
got, a picture of
Transmedics
the
machine is,
Transmedic machine.
for hearts, and it's actually quite amazing to look at it. It's so basically the heart. Everybody thinks that the heart is quite the most complex, and it's probably one of the ones that's quite easy to watch on.
Are you all
easy
right
to
watching
restart.
this?
And is that the one that's called the Heart in the Box?
It's Transmedics
Yeah,
machine,
yeah.
yeah.
It's like from Grey's Anatomy.
I watch
Yeah.
stuff like that all the time.
Yeah.
Yeah, and
So
that's just...
restart it.
Yeah.
Little electrical pump working away by itself there.
Now, there's not many of the transplant teams have this Transmedic machine yet. It's come up to Aberdeen once for a retrieval, and a heart's gone away on that machine, and I must say it was absolutely amazing. But
So
there
there's
is
no
only
electrics
6.
working that, there's
No.
nothing, it's just
Just the
literally
heart
come out,
getting-
been restarted, and all the machine's doing is pumping blood through it.
And what temperature is that?
That would be at normal body
Yeah.
temperature, that one, yeah, rather than being cooled and going away. So, because it's able to be oxygenated and the cells are getting the oxygen, so it's just normal perfusion for it as well. So, but more of the transplant centres are getting this piece of kit so that they can go further as well, because it's hardly ever that from Aberdeen that we've been able to have a heart be transported to the furthest reaches of England, and it's mainly at a timing issue. And they are always flown, even if they're going back to Glasgow for transplant from Aberdeen, they're always flown out. Whereas the team will come up by car, but if they're taking a heart away back to Glasgow, they'll be flown out of Aberdeen Airport as well.
So this is a bit of a silly question, but see on the flying, do they have to wait in like airport security and stuff when they've got such a...
No, they'll have a little aeroplane.
Okay.
They'll commission flights to do it, and then I've once gone out to the airport, I think, with a liver, and there's like a little wee 2-seater aeroplane sitting waiting on a guy, and you just go in the back gate of the airport. Kidneys will go on domestic flights, and they'll try and tie them up with a flight that's going out. And they're able to go by car as well. But if there's a flight, maybe if there's a kidney going to Manchester or London, they'll just put them on the next flight out of Aberdeen. So, but they go to a specific part of the airport to be
They don't have to do the
transplanted
scanner.
on.
So that is hand luggage?
Yes. Did you pack this bag yourself? Feel free to search it. The interesting thing is as well, whether you're into organ donation because it saves lives or because, you know, for whatever, or because it's because of health economics, because it makes sense kind of in terms of having somebody on kidney dialysis for a year, organ donation pays for itself, basically. But really it's cutting edge as well, cutting edge of surgery. The UK are world leaders now in donation after circulatory death and doing hearts. So historically, heart transplants would only be taken from people who were brain stem dead. So they go to theatre with their heart still beating, but they have died. And brain stem dead, they are tested in the ITU. They go through some vigorous testing where they test all the kind of nerves that come down from the brain and to make sure that none of them are working, and that person has actually died, their brain has died, and they will never regain consciousness or be able to breathe by themselves again. But however, they go to theatre with their heart still beating, their body's still perfused, and so the hearts, when they come out, they are fresh, if you like, kind of thing. However, the UK is now leading the way with doing donation after circulatory death. So this is where somebody is dying in the ITU. They aren't brain dead. We're withdrawn in care, and they have to die within a certain frame of time, half an hour, up to an hour. They would go to theatre, and the heart would be taken out. It would be stopped, taken out, would have died already, and then restarted, put on one of these machines, and transplanted. And what they've found is that I think they've done about 14 or 15, even more now, of these heart transplants from donors who have died and then gone to theatre, as opposed to being brain dead. And they've found that these hearts are doing really, really well, and that the recipients are doing really, really well after transplant. So it's something that the UK are going to have to start talking about soon. But we are at the cutting edge of what's happening in the world, in the kind of organ donation and transplant community in the world, not just in this country. You know, it's really exciting. So whatever kind of view whatever view I take of organ donation, every view is interesting, every view is exciting, every view is worthwhile. You know.
Yeah. Just one thing before you do shoot, just where the camera. If people are considering donating, so as next Thursday we have the donation drive on campus, so whether it be blood or organ donor, why would they sign a donation donor card?
Why would you do it?
Yeah.
Right, so it's one thing that you can do. You can save up to 9 lives, depending on the circumstance in which you die. You can save up to 9 lives, and if you think that 7,000 people are waiting, and 1,000 of those people will die waiting on the list, and that's a high percentage of people who will die waiting for an organ. We need to increase the amount of people who are on the register. And as I said before, there might be lots of people on the register, but the amount of people who die in the circumstances that we can retrieve their organs and they can be transplanted to other people and save lives, it's actually a very small percentage of people who can do that. But it is life-saving. Unfortunately, there aren't enough donors out there. We need to increase the numbers. There will always be people waiting, and people who will die within hours, within days, if they don't receive an organ. And these are from little children to adults. It's a no-brainer as far as I'm concerned. I know people have there are lots of views, different religions, but they have different views on organ donation. But no religion says no to organ donation. Every religion has said, yeah, if it benefits another person, then we support it. So every religion that we have in this country, there isn't any religion that has come out and said that we do not support organ donation.
And I think one of the more important things actually than actually signing up to the organ donor register is letting all your family members know what your decision is around about organ donation, so that it doesn't come as a shock to them if you are ever in that position as well.
Talk about it.
Yeah, yeah.
Because of every 10 people who've put themselves on the register, 4 out of 10 families will reverse that decision and say, no, I'm not prepared to go through with it. So even though you may say, I want to be an organ donor, if you haven't had that discussion with your family, you haven't told them you'll haunt them when you die if they don't go ahead with it, then statistics show that 40% of families whose loved ones have put themselves on the register retract that decision. So when you think about all the people that we've got and then take away 40% of those where people just didn't know, they maybe ticked that box when they're doing their driving licence but never discussed it with anybody, and so they didn't know their wishes.
I think that's being debated somewhere, that's going to be enforced by law, where right?
In Wales at the moment, they've gone to the opt-out system in Wales, and it was a huge publicity campaign over 2 years and more, and the organ donor register completely changed to incorporate all the changes in the Welsh law. So since the 1st of December, we've been going with the opt-out programme in Wales. So I think the rest of the UK are just waiting to see what happens, to see if there is any negative fallout from it. We're not aware of any at the moment, and I know of one family who have had a loved one go through the donation process without having discussed it with family, because he hadn't taken his name off the register. He hadn't signed, he hadn't not, and they said, well, there's been so much publicity around about it, if he hadn't wanted to do it, he would have taken his name off. So it has been done.
And they expected there to be a lot more people would opt out than have. And
it's tiny, it's about 3% of the Welsh population have actually taken the name off the register.
And they estimated 25% would take themselves off. So that, for Wales, it will make a huge impact. More lives saved. And until we can grow organs, which we can't do at the moment, this is our only resource for these people who are waiting. There is no other resource. So whether it's for health economics, and that's cut the NHS bill, make sure that we're not having to do so much dialysis or keep people in hospital for months on end in intensive care. Organ donation pays for itself. For the donor families, it gives quite a lot of comfort to know that something good has come out of something quite very tragic, and generally speaking these things are quite tragic when people die in the intensive care. for the recipients, obviously, this is a new life. It's a life-saving operation that they're having. That person has actually literally saved their life. So, I mean, I always think my body will either go up in smoke or I can use my organs for transplant, and for me it's a no-brainer. I hope for most people it is as well.
Maybe just quickly, why did the bill not go through at this point, do you think?
Well, I think what Scotland tried to do was take what Wales has done, and then they've added lots of extra bits onto it, and I think it just was too complicated for it to be passed, and I think they need to go back to the drawing board and kind of make it a little bit more simple, because...
Yeah,
So do you think it was justified that it didn't go through?
I think so, yeah.
It was just last weekend.
Just last week,
Tuesday,
yeah,
last Tuesday.
yeah, but I think it's almost going straight back through, and not as a private member's bill, but as something that the Scottish Government are going to take on themselves.
Well, what were the add-ons? Is it too long?
There's pages and pages of...
Yeah.
Yeah. They need to make it...
Belfast, they said that the senior consultant said we shouldn't have to do it because Northern Ireland has one of the highest donor rates in the world. So they said, why change it? You know, it might upset it. It's just...
You're,
It's like
you're,
as
sorry, I
well.
was just going to say, your question was, you know, you're doing this thing next week, and why would presumably mostly students sign up? In 1980, I was a first year student in Glasgow, and one of the first things that we did was they had I was at art school in Glasgow, and they had a blood donation bus. You know, so all the students were roped in to give blood, and I did that at that time. And at that time, I signed up, you know, because they take your blood thing and put an organ donor card as well. At that time, and I was 18, and I thought probably, if I'd thought about it, I was more likely to be an organ donor than a recipient. I didn't know at that time that 30 odd years later I was going to be a recipient. But all the time I'd had a donor card, you know, so it works both ways. You know, if you're quite happy to receive a life-saving donation, then it makes sense to. You ain't got to get that unless there are people like yourself who are signed up as donors, and that's the way. That's the current way to do it. So, and there's no. The reality is that the you know, the accidental deaths are you know, quite a high cause of death proportionally among younger people, and the younger you are, the healthier your organs are likely to be. A lot of people who are walking about thinking they're perfectly healthy, they might die in circumstances which are not related, but it turns out their organs are already damaged. They didn't know. And they're no damaged organs, no use to somebody who's already got a damaged organ.
I think within Scotland we've done a lot of promotional work within all the schools, and like from 4th year upwards. So I think the proportion of young people in Scotland on the organ donor register is greater than 70%. So under 25s in Scotland on the organ donor register, we've got a huge proportion. And like that programme has been running for more than 10 years within the schools. They've had a couple of videos go round all the schools round about, and the teachers have had access to that as well. So
Young
It's
people have a
fantastic.
really healthy attitude towards it. They just
yeah,
see it's
they just
recycling.
see it's as normal, yeah, and they don't have any issues about it at all. So.
And I think it's fantastic that the DVLA sends their, you know, or it has like a tick box when you register your driving license
Yeah,
here.
yeah,
You know, it's
I
great.
know. So, like for all the changes that were done with that task force review as well, within the UK donor numbers went up by 63%, but within Scotland they went up by 99.6%. So we nearly doubled the number of donors that we had in Scotland. So, and Aberdeen as a hospital is doing really well with the number of patients that go forward for donation, just through the hard work of everybody in the unit, just considering every single patient for the potential for donation. And then it's the families that say yes, or the patients that have already put their name on the organ donor register. So we all thank them really.
Thank you.